Hey folks, today is Monday, February 22nd, and lots of good things happening this week. We've got clinics going on around the communities. Exeter actually finishes up all of its clinics this week, and Birch Hill and Riverwoods Durham finish theirs next week. And what that means is we are getting closer and closer to the date and time when our independent living residents are fully vaccinated plus 14 days. And what that does for us is it allows us to have more freedom within our daily lives. So you can be comfortable once you are fully vaccinated, which, let me be clear, means you have had 2 shots plus 14 days, so no cheating there, no cutting corners. But once you've achieved that fully vaccinated status, you can feel comfortable being around other people who are fully vaccinated. The risk is not zero, but it's still very low. And so that might be your neighbors within your Riverwoods or Birch Hill community, or might be family members, and that's great. The state of New Hampshire has changed some guidelines for folks who are fully vaccinated. Number one, if you are around someone, if you're exposed to someone who is COVID positive, but you're fully vaccinated, you do not need to quarantine for 14 days, so that's great. And secondly, around travel. If you're fully vaccinated, you do not need to quarantine if you leave the region of New England. However, just a couple caveats there. Number one, if you travel internationally, Riverwoods, we will require that you quarantine. It's not a good idea right now. Number two, driving's an awful lot better than flying. When you think about you want to move about, driving is you in your car, maybe with your spouse or someone else who's fully vaccinated. Flying means airports, it means airplanes, it means being around people who are very likely not vaccinated yet, because we're the lucky few at this point. We are among, at this point, about 4% of Americans are fully vaccinated, and that means 96% of people that you're around aren't. So it's just really not worth the risk yet when, in a month or 2 months, 3 months, that proportion will change dramatically. So kind of hang in there would be my advice. In our public areas, even as we begin to open up dining and social opportunities within our communities, we will still require a mask and social distancing, and we'll do that until the CDC or Department of Public Health tells us that recommendation is no longer necessary. We'll open up our operations in a gradual way, and your executive director will be sending out to you, specifically within your community, order of operations and timing. There'll be a little bit different community to community just based on the specifics of each community, but the executive directors are going through that now together and then with their teams to work out how to open things up in a very safe way. The last thing that I really want to talk about is being the sort of the first group to get vaccinated. I believe, and I'm sure you do too, we have a responsibility. Because you're vaccinated, when you are fully vaccinated, it's very unlikely that you'll get sick. You may get no symptoms. You may never know if you're positive. But what's unknown right now is whether or not you would be positive and spread it to someone who isn't. And so considering that the vast majority of folks outside of our communities are not vaccinated yet, you have a responsibility to the outside world. Keep your social circle small, be around people who are fully vaccinated, wear your mask, avoid restaurants still. I mean, restaurants are sort of the triangle of bad right now. You got to take your mask off to eat. Although the number of times I've tried to eat with my mask on doesn't work. You're going to be around people you don't know, and you're going to be inside, at least, for the foreseeable next few months until the weather gets better. And it's not worth it yet. Not when we're so close to things getting better. So I just want to end with that and just say, we have been talking about science catching up, and it has. We still have some risk with these variants that are out there, though it does seem like the Pfizer vaccine is effective with those variants. We don't know what will come, but we do know that we're making progress. People are getting vaccinated. putting 1.6 plus or minus million people are getting vaccinated every day. That number should increase when the Johnson & Johnson and then hopefully the Novavax vaccine come out. Good things are happening. And so it's time to kind of hang in there for a little while longer. Choose who you're around. You can live a little broader with vaccinated folks, and you have a great majority of your residents, your neighbors within your community are, as are our staff. So all good things. Hang in there. Don't do anything crazy until you're past your vaccinated plus 14 days. And until then, stay healthy, my friends.